Health experts say the vaccine and booster offer the best protection against serious illness with COVID. But for those who are immunocompromised, there's questions about what they need to do to build up their immune system. Jade Cunningham verifies if additional vaccine doses are needed.
All over the U.S., COVID-19 vaccines are being administered daily. And for most, experts say 2 to 3 shots will be enough to build a proper defense against the virus. But we've seen people asking on social media about those with a weakened immune system and if proper protection means getting an extra dose. So let's verify. If you're immunocompromised, is it recommended you get an extra dose of the COVID-19 vaccine for better protection? Our sources are the Centers for Disease Control and Dr. Lucio Mille, who works with LSU Health's Genetics and Precision Medicine Lab. First, the CDC defines someone to be immunocompromised in several ways, including if they're receiving certain cancer treatments, if they're an organ or stem cell recipient, or if they have advanced or untreated HIV.
So these people also need an extra hand to build an immune response because their immune responses are being kept down by medications for other reasons.
For those who got an mRNA vaccine, either Pfizer or Moderna, the CDC says after getting the initial 2 doses, some moderately or severely immunocompromised people will need a 3rd dose. It'll be given 28 days after the 2nd shot. And Mille wants to be clear, this is different from a booster.
So a booster dose is used when your original vaccination series elicited a strong immune response, but that response is declining in time. An additional first dose means that the first 2 doses have not achieved sufficient immune response, and so you need an additional dose to complete your primary vaccination.
So they'll take a first shot, a second shot,
a 3rd shot, and that's their full vaccination. Then they have to wait for a period of time that depends on what vaccination they had before they're eligible for it.
So yes, it's true. It is recommended you get an extra dose of the COVID-19 vaccine if you're immunocompromised. With your Verify, I'm Jade Cunningham.
And for those who are immunocompromised and initially got a J&J shot, the CDC recommends no additional doses at this time. But it does say those 18 and up should get a booster shot of Pfizer or Moderna 2 months after the first dose.